one of the real lessons that I've learned from the Department of Veteran Affairs is that leadership, typically people think about how can I grow programs, how can I further develop areas and explore new grounds. I've really come to believe that in healthcare, one of the real responsibilities of leadership is to actually break down silos. And we've become so specialized and we've become so disintegrated in the way that we deliver care by simply looking at the way our system works and being able to break some of these silos down. I think leaders can do the most good and have the biggest impact. And so when we talk about getting people to be healthy and well and functional, you're really talking about the intersection of mind and body. And what does that mean? That means being able to understand the importance of movement, the importance of psychological health, the importance of the physical condition of the body, the thing that traditionally physicians have thought that's their area of responsibility, but also many of the social interactions, the economic interactions, the spiritual interactions. And the more that we can begin to integrate the way that we think about health and wellness as being a more comprehensive definition, I think the more good that we're going to do in addressing the illness issues that we see so prevalent in the population, whether it's weight loss, whether it's behavioral healthcare issues like depression, or frankly, issues that relate to very common things like pain management or physical limitations that people have. So I think that what I learned in coming to the Department of Veteran Affairs is that I actually broadened my definition of health to include those things. And what's so great about the VA is that when you're freed from many of the reimbursement challenges that our colleagues have to deal with every day in the private sector, when you're free of those reimbursement challenges and you get to focus on what's the right thing for a person, for a patient, you come up with an answer that's much more of a whole health model that integrates psychological, physical, and movement health.
Hmm. Yeah, and we talk about breaking silos. I reminded of a quote someone told me once, which is innovation is not about invention, it's about adoption. And so much about adoption is breaking down those silos so people can work together more as a team.
Yeah, and that's where I think leaders really do have that responsibility because you can come in and you can caretake an organization. You can incrementally improve it. You can improve your, bottom line results. You can improve the outcomes, but it's really only the good leaders that really take a look at what they're doing and saying, are we doing the right things? Is there a better way of delivering the care? Is there a better way of impacting people's lives? And sometimes that means having to break down systems that simply are barriers that aren't working for people.